2020 to 2021, there were 243 cases probably in Montserrat alone. I'm sure the other counties have a lot of cases that have not even been reported. But out of those 243 persons that had chronic kidney disease, 195 of them died. So that's about 80% of the people that we even got record of. 80% of them died. 195. So that's a big number of people that died from one disease. And then 1/3 of these, or 243, were young people less than 30 years old. So this is very important for us to know that. So this is why we need a unit like that. A lot of the people in Liberia, when they have kidney disease, those who can afford to fly out of the country will fly to Ghana, Sierra Leone, or US, India, to go and take care of their problems, to even get dialysis. But we want to cut all of that off. So with the help of a lot of great people, Ambassador Talawaya, Dr. Punagari, other people that had this idea in mind, we finally got it on the table. And we'll be talking more of the history tomorrow as we launch the project.
Okay. Now, Dr. Jallah, somebody listening to you who's deep in Grand Crew, where I come from, an old lady is there. She said, well, I don't know about the significance of this machine or this new units that they'll be launching. Why is it so important to the country?
It's very important because it's life-saving. Okay, a lot of people don't even know what the kidney does. First of all, the kidney is like a filter or a sifter. So those of you who can equate the kidney to a sifter, you will know that the sifter, if you put palm butter in the sifter, you will get the palm water, and all of the chaff will leave in the sifter. Also, if you do fufu, all of that chaff from the fufu will leave in the sifter, and then you will get good fufu to cook. So the kidneys does the same thing. It filters all of these bad things from in your blood for your blood to be clean for you to function normally.
So are you saying that now with this new unit that will be set up at the JFK, Dr. Jallah, are you saying that someone who is diagnosed of having a kidney problem cannot fly anymore abroad?
No, they don't have to fly anymore. They come there, and we should be able to sift out their kidney, take away that bad blood, and then they will be. That's what we consider the treatment. Okay. At least that will prolong their life.
Have we had this sort of unit before? You've been in the health sector for quite a long time.
I don't remember us having such a unit. I remember some people do something called peritoneum dialysis, where they put the tube into the stomach and then they filter the blood. But now this unit we use machines, which is almost like an artificial kidney, pass the blood through there to do the cleaning for you, and then put the blood back in you, and you should be able to leave the center.
Now, so why do you have it positioned at the JFK?
Well, it's not in the hospital itself, it's in the yard. You know, you don't want to pay rent to building, it takes away money. And dialysis is a very expensive venture, because you got to pay for the grafts, you got to pay for consumables and other things. So we had a building already, one of the old NDS building. We were able to renovate it and bring it up to standards to be able to start the dialysis there, which is much better for Liberia, and it's much better for the patients, because the nephrologists, we were able to bring in a nephrologist, which is the kidney doctor, to come and...
So we don't have one here?
We don't have one. We are sending people out for training, but in the meantime, we have to bring one into the country to look at people, to recommend them to go on this machine. Okay. We have 3 nurses. We have another doctor in the country that will train some of our people to be able to put these grafts in so that people can be able to receive their dialysis.
Now, you are saying that you have to bring in a doctor a kidney doctor. You also had to train more nurses and all of that. Give us an idea, Dr. Jallah. I walk to that center. What am I going to see? Is it just a machine, a small something, or a very big machine, and I see doctors and nurses all connected to it? Or what am I going to see there when I walk in there?
When you walk in there, you should see a very pleasant environment, welcoming environment with trained staff. And after you get all of your interviews and everything, then you should be able to go to the unit. We have like 3 rooms. We have 10 machines at this time, and
10 machines. What kind of machines are they?
10 of the dialysis machine. Set up, one in an open place, some for privacy if you need to be in a private area. And you will meet a nurse once you have your catheter in. You will meet a nurse, and she should be able to start you on the machine, or cleaning your blood, and or you will be in a relaxed environment, listening to soft music. So we try to make it a pleasant experience for the patient who is already tense because they have to go on the machine.
So we have 10 of that.
Yes, we have 10 right now, functioning, brand new, functioning currently in the country.
Now, refresh our memories, Dr. Jallah. What was the effort made in getting those dialysis machines in our country?
Well, I'm sure people will say machines been here before, but machines, once you get it here, you really have to be on top of it. You need a water supply, a special water supply that will run the water through the machine. A lot of people, starting from 2011, documents were signed, but Ebola came. Dr. Bobo was one of the people that were trained first. He died, and so we had to send a new group of people to be trained. We had to follow up on making sure that we have what we needed in the country before we said we were going to open. So it took a couple of years. But at least in 2022, finally, from the time the paper was signed, it's almost 10 years. But at least we can say it's here. That's the important thing.
Now, normally, Dr. Jallah, do you have to have about 10 of it, or you can have more than 10 of it?
You will have more. The project or the end result of this is that we need to have one in each county so that people can travel from all the way to other counties to come to Monrovia to have their dialysis.
Each of the center? Each of the machine?
Yeah, you need to have a machine or 2 in each county. But at least we're starting with 10, or we should be saving some lives, at least until we are able to get more, or to be able to open the other centers.
Now, you made reference to costs, sir. You said it's highly costly to maintain such a unit. What makes it costly?
Well, first of all, you need the grafts. Okay, they got temporary grafts and they got permanent ones. So the temporary ones will only last for a short time, and the permanent one will, they will insert it and it will last for some time. Those grafts are expensive already by themselves. Then the consumables to run the machine, to maintain all of the things that you need for one patient to have one cycle. And most dialysis patients have this at least 3 times a week. So one of the things would be to make sure that those consumables are affordable, for people, or the support that we need to maintain it, so that for the those who can afford to be able to at least have their dialysis.
So tomorrow will be the dedication of that unit, of that center. So this a major achievement under this administration. Now tell us as to who are some of the guests you do expect tomorrow to attend the program.
Well, we expect the president to be there. We expect cabinet ministers. We're hoping that ambassadors and other well-wishers and people who have been on dialysis before and want to see. People are doubting Thomas in the country that say, how can they do it? They don't have the water, so we want them to come and take a look and see what, through the initiative of the president, we have done.
Let me get your impression. Dr. Jallah has been in the health sector for quite a long time. I know not dialysis machine, especially in the public health. Now that is happening under your tenure at the ministry. What's your impression?
Well, I'm happy because we have seen a lot of people, like I said, those numbers are very alarming. And we have seen a lot of people go into kidney failure. Kidney failure people, there's hands swelling, there's feet swelling, or there's water in their belly. Especially we have such high numbers of people with hypertension and diabetes, and in the young people, inflammation in the kidneys. This is not something that's going away. And we need to beef up, those non-communicable diseases like the diabetes and hypertension to catch people early so that they don't go to this type of disease. But it's good to know that if this happens, that we can do something now instead of seeing our loved ones die. So this is, I'm very excited about making sure, and the team, we have such a great team that worked day and night. Deputy Noble Howard, or Dr. Kete, or Diana, the nurses, the doctors that we invited, Dr. Wachika from JFK, the whole JFK family, all have worked together and to make sure, and we want to save as many people as we can on these machines as we go along.
Now, Dr. Jallah, I know I'll be opening the lines very, very shortly. It's happening tomorrow, right? At what time?
At 11 a.m. in JFK compound in the back where the ONDS was. We did the work back there.
You already have a budget, and I often you sometimes talk about how it's not that much to run the routine, and sometimes also the like the COVID and other life-threatening diseases are often pop up. And now with this dialysis unit, does it mean that you have to have an increased budget, or what does it mean?
Well, we're hoping that we have an increase on that line to help with the dialysis. But we're hoping that it will be a small income generation place, because if you make it free completely, then how do you replace the consumables? Now we have some to start, but we have to continue purchasing, making sure that this center runs not for the short term, but for the long term.
Okay. 0776-540-987. Again, 0776-540-987. Better still, 0880-514-096. Again, 0880-514-096. That's the numbers to call, and you are live on the SMS. For the first time, if you have kidney problem, you're not going to travel out of Liberia. His Excellency Dr. George Mano Weah's administration has brought one, and the center will be launched tomorrow. Let's hear from all of you. Good morning.
Good morning, Chief.
Good morning, sir. Your name and where you calling from quickly?
My name is and I do join from my resident Welsh on Riverside.
Let's hear from you.
Once again, I want to say thank you to Dr. Jallah for her effort made for the Liberian people. And then once again, I want to say thanks to the government for always supporting the health ministries of Liberia. I'd like to say congratulations once again to Dr. Jallah for always making headlines for the Liberian people. And then I would like to say a blessing. Thank you for COVID-19 and unique program today. I hope it will be successful. Governor Liberia, government officials of Liberia will go in input.
Okay.
Thank you very much.
Many sectors, 0776-540-987, or better still, 0880-514-096. These are the callers on the line. Good morning.
Good morning.
Good morning, Mama.
I'm okay. My name is Cecilia C. from Manasoma.
Okay?
I'm just calling to say thank you to the Minister of Health
Mm.
for this great achievement. And as we see her work, we are all convinced that she's giving a real meaning to our well-trained, skilled, and motivated sector hospital health workers to serve this mission. I'm proud of her and also thank you for treating lectures and enabling them to be able to serve this population. Thank you.
Many things, many things. Let's take this call on the line. Good morning.
Good morning.
Yes, sir.
Good morning.
Yes, sir. Go right ahead.
Good morning.
Go right ahead. Good morning.
Good morning.
Oh, it seems good morning.
Okay, good morning. Once again, this is Christopher Tiro, son of the former chief of local county Weah district, coming from my own hometown, that is Weah. Good morning, Honorable Minister.
Good morning.
Yeah, in the first place, I'd love to say a big thanks to you, one lobby, by accepting Chef's position from Excellency President John Weah to come and then serve the Liberian people. May the Almighty God bless you, and we pray that you should continue to get more wisdom to see how best you can work with the ability of you, that yes, indeed, President Weah government should be one of the best governments. And we also pray for your 4 years to come, and you, the Honorable Minister, you also remain in that position for years, for this 4 years. In Jesus' name.
Amen. The man is praying. Oh, good morning.
Good morning.
Yes, sir.
I'm Jeremiah. We are calling from Tipiano.
Let's hear from you, sir.
I want to tell the minister thank you for that particular segment to bring the doctor in Liberia, because that segment is kicked one of my brother. So I tell the minister thank you very much. I'm also asking the minister to also help to send one in the town, in government hospital in the town here, because the people too, they need that for doctor to come in the town government hospital. Thank you.
Okay, many thanks. Let me take this call on the line quickly. The caller has been there. Good morning.
Good morning, sir.
Good morning, sir.
I come from Balance Hill. I'm in Manga Cooper.
Okay.
First, I want to thank the minister, and together with the government of Liberia, it's a great initiative. I want to applaud government for such a great move. I want to also thank the president for supporting the minister of health for this great initiative. God bless them.
Many thanks. I'll take this call on the line. Good morning. Good morning. 0776 540 987. This caller. Good morning. Good morning. Oh, it seems this caller is not ready. 077. Let's take this other call on the line quickly. Good morning.
Good morning, Summer. How are you this morning?
I'm okay.
And good morning to the minister. You know, Summer, as I'm driving my car this morning to go to work, tears is in my eyes. Because I know the importance of dialysis in the nation. I live in Ghana for a while, and I saw what dialysis did to many of my good competitors that today they stay alive. So I just want to use the opportunity to express my thanks and appreciation. And my hats off to Dr. Jallah. I've known Dr. Jallah for some time. She has worked with my wife before. I mean, she's a very good woman that is passionate about health. You know, and I know her very well. She is passionate when it comes to the health delivery system.
Okay.
I know her very well. I want to thank her for that. And I also want to thank the president for giving her the opportunity to come and serve our country.
Okay.
And when she was appointed as a minister, I was so excited. I said, wow, yes, we will have one of the best minister of health that is passionate about health. Thank you, Dr. Jallah, for doing what I do for our country.
Many thanks as well. Many thanks also. Good morning. Let's just go on the line quickly. Good morning.
Yeah, good morning.
Yes, sir.
Yeah, this is Thomas Babana calling you from Weah district.
Okay.
Thank for the promotion for re-election of Babuna in Weah district. Okay, I want to commend the Honorable Minister in the ministry this morning. Thank you for the level of work you have done in the improvement of the rural, especially the health sector. You know, we always tell people, the good government you can see it. This is the government that want to change the life of the people. And we'll continue to pray for President Weah, for God to better way. That's how we'll continue to enlarge our people on a daily basis. As President Weah is the most sending man that came to serve the people of Liberia. We are not joking. President Weah have 12 more years. After the 12 years, we'll tell him to resign and then come back to serve the people of
Can you
Liberia.
imagine that? Okay, thank you. Many thanks. Many thanks. Many thanks. Okay. 0776-540-987. Take only 2 more calls and we'll wrap it up quickly. 0776-540-987. Good morning.
Good morning, sir. How are you?
I'm okay, sir.
This is Deputy Minister Latin Datong from MOE.
Okay.
First, I want to say congratulations to the President. This is monumental for Liberia. But I also want to say congratulations to my good friend and big sister in your studio, Dr. Jallah. Dr. Jallah knows how much this means to me because very recently I had to be flown out of this country to Ghana to get dialysis. I was at the point of death and she was instrumental in helping to save my life. This is important for our country. This is a milestone and I will be there tomorrow, Doc, because this is something that is personal. It is beyond just what the government is doing. It is about saving lives. This president and this minister will go down in our history for this particular achievement because lives will be saved in this country.
Okay.
Thank you.
Many thanks, Mr. Minister. Let's take this according to the line. This last caller. Good morning.
Yes, good morning. Hi, good morning.
I'm okay, sir.
This is Francis Jusu from Weah District, Ilufa County.
Okay. Let's go right ahead.
To be precise, from rural community.
Okay.
First and foremost, I want to commend you and the studio guests for this important discussion this morning. With relate to the health issue, I also want to applaud our district health workers that are in the district for to be precise. They are doing extremely well when it comes to any new symptom, sickness. The information will be disseminated to us. And especially what I'm hearing, I'm happy with regard to the kidney issue because that sickness has been disturbing people in the country. So I want to applaud and we pray that God will give them strength and power to see how best they will be able to at least accommodate all those things so that the things can go down well with all of us in this country. Thank you so much for this program.
Okay, many thanks. Let me squeeze this one in quickly and then we call it a quit. Good morning.
Good morning.
Yes, good morning.
Yes, first let me thank the government for this wonderful thing they have done, but as much as I appreciate it, but my concern now is how possible for the mayor who is not making so much to have benefit of this.
Okay. Okay, many thanks. The minister will answer that. Madam Minister, you can respond quickly.
Well, we will do our best to support those who we are looking for funding to make sure that we can subsidize some of the people that will be coming to the center. We have to keep the center open and we have to continue saving lives. So we're going to continue to advocate for those who cannot afford the dialysis.
Okay. Well, all the callers have been commending the president, commending you as well. But just again, give us an idea. You did earlier. What will be happening tomorrow and what time and where do we expect the dedication to take place?
Well, the dedication will take place in the JFK compound or around the NDS area. This is where the new center will be open and it will be at 11 o'clock in the morning. But we just want to say if you having any patient in any of the counties that you think has a kidney problem, swelling, or and their blood level is low, they are passing blood or protein in the urine, and any of those symptoms. Right now, the nephrologist is at JFK, so you can refer the patient there so that we can make sure that if we examine them, if they need dialysis, they can be one of the patients that will receive this life-saving treatment. May God bless all of us here in Liberia as we move things forward to save more lives.
Well, that's the voice of Dr. Wilhelmina Jallah. Dr. Jallah is the Minister of Health of the Republic of Liberia. Dr. Jallah, thank you for taking time of the busy schedule.
Thank you, and thanks to all of the healthcare workers for their continuous support to the sector.
Okay, so let me have it informed that I'm taking my exit now. I'm going on a sabbatical. The women have sent me on a sabbatical. You know, they say I should go and rest a bit because they'll be here to occupy the studio. Beginning the 1st of March, that's tomorrow, up to the 8th. They'll be holding a couple of discussions marking the International Women's Day. So TTG Bro and the rest of the team, the Director General, I'm told that she will be the producer for their program. I hope she'll get the strength, you know, because it's a bit difficult, but I know the DG will. Until then, Saba George is my name. There's no second chance for first impression. Have a pleasant time.